Hello parents, it is Allison again. I am an occupational therapy assistant student at Pima Medical Institute and I have been working with Miss Ariel. So today we are going to discuss proprioception. And proprioception is essentially a continuous loop of feedback that can be found between your sensory receptors and throughout your body. So on the skin, your muscles, joints, and what happens is the sensory receptors that are in your body are going to essentially send a signal to the brain saying, hey, this person is moving, either that or they're experiencing some form of weight or some form of force on their body. And then from there, we are able to respond accordingly based off of the signals that our brains send back into our body. So before we begin discussing activities that are super beneficial for your kiddos, it's really important to note that the purpose for doing these activities is understood, as well as when you'll be doing these activities, how often you'll be doing them, where you'll be doing them, and so forth. So when I say what's the purpose of these activities, for some kiddos it may be helping them to calm down. And then for other kiddos, it may actually be helping to increase input. So working with your occupational therapist or your occupational therapy assistant to understand why this benefits your kiddo, and then also to understand when this activity will take place. So would your kiddo benefit from doing this activity maybe before they're asked to do homework? Or do you have a kiddo who would benefit from doing this activity after they've done homework? And so again, really understanding why that's important and when they would benefit from the activity. And then in addition to that, knowing how often you should utilize these activities. So as an example, for some kiddos, if they're really seeking proprioception to calm themselves, it may be beneficial to do a continuous amount of activity. So maybe 10 sets and then rest, and then 10 sets and then rest, and then 10 sets and then rest. And for other kiddos, they may just have to do something once before they're prepared to return to their work. So let's go ahead and let's get into it. A handful of different activity or activity ideas. The first is weight bearing. Weight bearing is an excellent proprioception activity. This can be done in many different ways. And so we're able to do push-ups, we can crawl, we can do wheelbarrow walks, which we also discussed in our vestibular PowerPoint as well as video presentation. Crawling really can look like a bear walk, so something as simple as just getting on all fours and crawling, just like that. And then push-ups as well. You can do push-ups with a piece of furniture. You can also do push-ups on the ground. If you need a modification, you can do push-ups on your knees. So I'm going to go really quickly over an example of push-ups on your knees, just because that's an excellent modified push-up. And so just a quick example, down on your knees. Hopefully I don't slide on the tile. You're going to kind of come out, and you're just going to go right down nice and easy. And again, nice and easy. And so that's a really, really fun activity, and it's a better modified version of how to do a push-up. And then from there, heavy lifting is an excellent example of another wonderful activity. So heavy lifting can be done in a number of different ways as well. So an example of this could be utilizing weights. I have some weights right up here as an example. And if you don't have weights, utilizing books as well. So two different examples. This is an 8-pound weight. Really easy to come by these guys, but just providing your kiddo with any weight, it could be half a pound weight even, having them walk around with this weight on either side for some bilateral coordination. And then also, if you don't have weights, books. Books are just as heavy and they're gonna work just as well. Even handing your kiddo a set of books and just having them hold them out, having them count out loud with you, maybe having them read the title of your book while you're working. These are all completely appropriate activities for heavy lifting. Next is resistance. So again, this is something that we discussed a little bit when we were discussing vestibular, but pushing as well as pulling. Anything that you have, yesterday I used an ottoman as an example. putting weight onto an ottoman and pushing that ottoman across the floor, and then maybe grabbing onto that ottoman and pulling it back. Those are excellent tools. Today we worked with a kiddo and we had them sit in a laundry basket and their sibling pushed them and pulled them, and then they took turns rotating. Excellent way to incorporate an activity that's fun with siblings or with friends or with parents. Oral is another excellent activity, so oral activities in particular. Chewing as well as blowing bubbles are both excellent activities. So blowing bubbles can be kind of messy. Obviously, doing it outside is going to be best case. If you aren't able to blow bubbles, or if you're indoors working, having a necklace on that has some sort of a rubber item that their kiddo or that your kiddo knows they can chew on, that's an excellent idea. Especially if they're doing any chewing on themselves, maybe some biting, just reminding them, hey, let's go ahead and let's take your bracelet or your necklace and let's chew on that instead. Excellent activity. Moving right along, we have cardiovascular activities. These are exactly how they sound. So anything that's going to require a decent amount of movement, jumping and running are definitely going to be my most favorite. Just racing with your kiddo. We're going to start right here at this line. We're going to go to the door and we're going to run back. See how many times we can do that, or maybe pause, take some deep breaths, and then do it again. Those are excellent forms of activity. Jumping, if you do have a trampoline in the house, jumping on the trampoline is wonderful. If not, and you're comfortable using the bed, this is definitely a good way to grade an activity down safely, meaning to make it a little bit easier for the kiddo. And standing with them while you hold your hands and you allow them to jump on the bed, maybe count with them how many jumps they're doing. It's an excellent cardiovascular activity, and it's also a way to keep it safe is by helping them out. Another proprioception, activity is deep pressure. So this may not seem like an activity necessarily, but it is a fantastic proprioception tool. Bear hugs is one of my favorite, and it's something you can just tell your kiddo to do. So just give yourself a big bear hug, squeeze, squeeze, squeeze. Obviously, you can incorporate bear hugs with someone else as well. I am currently solo, so I'm hugging myself. But if you're with someone, if a kiddo is comfortable and you have permission to give them bear squeezes, if you're obviously a parent and your kiddo needs to calm themselves, just giving them a big bear squeeze is going to be an excellent form of deep pressure. Weighted blankets is also, or weighted vest is also an excellent way to provide some deep pressure independently. So this may be a good way to grade an activity up, meaning make it a little bit more difficult for the kiddo. Instead of providing them with the deep pressure, saying to them, let's put our vest on, and having them work independently to give themselves that deep pressure. The last two that I have, we have functional as well as passive activities. So some of these activities are going to fall under either category, but I think it's really important to note both. So for functional, these are excellent everyday activities. So just like our activities of daily living, something as simple as dressing can be an example of functional activity. If we're doing IADL, so independent activities of daily living, something like cleaning up your bedroom is a great functional activity. So saying to a kiddo, hey, you've got 5 minutes, let's clean up this space, that's functional activity. They're going to be doing some heavy lifting, they're going to be doing some pulling, maybe some pushing, and so that kind of incorporates a lot of these different activities. In addition to that, passive, which is going to be very similar to deep pressure, but in a different format. And so passive activity, one of the examples that I really, really love is the hot dog. Sorry about that. So the hot dog is essentially wrapping a kiddo up into a blanket, just like a hot dog, and then, joking around with them. I'm going to put some mustard on you, and maybe giving them some mustard, or I'm going to put some ketchup on you, or maybe I'm going to add some relish. And this is a fun activity that your kiddos can do with siblings, with friends, with loved ones. And then if you're at a clinic, we can also do sandwich if you have a mat, laying on the mat and then putting another mat over them to provide a little bit of that deep pressure, and then maybe even allowing someone to lay onto that mat, or using an exercise ball to sort of roll on that mat to help to roll out the kiddo is also an excellent example of a passive activity. So I hope that you enjoyed this video and that you were able to take something from it. We've now gone over vestibular as well as proprioception and some really wonderful activities for both. Thank you so much for listening. Have a beautiful day.